and then I'll move to auscultation. With auscultation, we'll want to listen with the diaphragm of our stethoscope or the bell, whichever one you prefer, and we're listening for any type of abnormalities, any type of regurg or murmurs. No murmurs present. And now we're moving to the pulmonic valve. Tricuspid. And the mitral. And now to assess for the apical pulse. Okay, Jeff has 76 beats per minute, which is regular rate and rhythm. I'm also going to go ahead and, when you're palpating the chest, you're feeling for any types of thrills or bruits, which he has none. There's an absence of thrills and bruits. And normal pulse for an apical pulse is 60 to 100 beats per minute. So Jeff has no abnormalities in that area. The next thing that I'm going to go ahead and do is go ahead and palpate his radial, brachial, popliteal, as well as his dorsal pedis pulse and his tibial pulse as well. So the first thing that we're going to go ahead and do is, when you're palpating for a radial pulse, I'm going to have you go ahead and turn your arm like that, and you can use 2 to 3 fingers. And typically it runs the line. You take the patient's thumb and you can trace it back right here, and you're feeling for a radial pulse. Following the patient's pinky line, you can actually assess for a brachial pulse, which he has no thrills or bruits, no implanted devices as well. So the patient's pulse is a regular rate. And then with the Allen's test, which normally you can do it front, I'd be in front of the patient, but you're going to have the patient make a fist. And what this test is actually designed to do is to see if there's an occlusion presence. So go ahead and relax your fist. And you're going to identify the patient's radial pulse along with the radial artery. And what you're going to do is you're going to have the patient make a fist, and then you're going to press, once you find these two, which I found, you're going to have the patient make the fist, and then you're going to occlude the two, the radial and both the artery as well. So go ahead and make a fist, and then let go. And what you would see here is the red marks, and then as you lift up, depending on how fast those red marks go away, it's going to tell you whether or not you may have an occlusion. It's not going to tell you definitively. It'll just, as a nurse, you'll know to, hey, maybe order an additional test and notify the doctor. Sometimes you'll just know, you'll know this by it taking a little bit longer than normal for the blanching to go away.